All righty. Welcome everyone from coast to coast to coast for joining us today at another edition of our Ostomy Canada Society National webinar. We've got a fantastic topic for you all today on tips and tricks to successfully managing your ostomy. And we have a couple fantastic guest speakers with us today. Before we get any further, I just want to do a couple quick housekeeping items. Firstly, this is going to be recorded today. So if you have any family, friends, colleagues who want to be able to watch this after the fact, it will be available on our ostomycanada.ca website. So do make sure to check it out after the fact. We're also going to be doing a Q&A portion at the end of this webinar, and thank you to all of those who have already submitted a question in. That's helped inform our presentation today, and it'll help inform some of that discussion at the end. That said, if you do still have a question throughout the duration of the presentation, feel free to use that Q&A tool in your Teams toolbox there. You should be able to see the Q&A little bubbles there. And we'll do our best to get to as many questions as possible. Note that we're going to get to as many as we can, but if for those questions that we might not have time to get to today, we do have quite a number of other topics we've covered on our ostomycanada.ca website in past webinars, like our peristomal hernia ones, our diet ones, our managing the bulge, all that kind of stuff there too. So whatever we don't get, we still encourage you to go check out some of that education we have as resources online. So as we get into this discussion today, I'm going to be inviting one of our friends at Hollister, Tarek Allam, who's going to be doing a quick little introduction and being a great resource at the end of the presentation. Tarek began his nursing career as a registered nurse in medicine and surgery at the McGill University Health Center in 1995, and he entered the role of enterostomal therapy nurse clinician in 2000, and subsequently completed his training from the Canadian Enterostomal Therapy Association, or what is now called our NSWOC Canada. And Tarek is active in the association for many years as a competent expert for the NSWOC's web-based certification program and as a regional director for Quebec. Tarek joined Hollister in 2008 and is the clinical affairs manager. He completed a master's degree in clinical science from the University of Western Ontario with a specialization in wound healing, and is a lecturer for the Department of Nursing at Dawson College in Montreal. So Tarek, welcome so much. I want to say thank you as well to Hollister for having you here and for being able to provide the education that Laurence is going to be talking about today. We really appreciate it. And I'll pass over the mic to you to introduce our guest speaker today.
Thanks so much, Troy, and thank you to Ostomy Society Canada for having us have this wonderful opportunity. I'd like to introduce Laurence Quintin, who's a nurse specialized in wound ostomy and continence. I've known Laurence for many years. She's been a nurse clinician at the Jewish General Hospital of Montreal since 2013. Laurence began her career on a unit specialized in general surgery, colorectal surgery, and has worked in urology and gynecology oncology, where she discovered her love of and interest for people with an ostomy. She therefore decided to continue her studies in enterostomal therapy nursing and graduated from the enterostomal therapy nursing education program in Canada in 2017. She's worked as a nurse care counselor in wound and ostomy since 2016, and much of her experience has been in acute care. However, she's also gained experience in long-term care and the home care setting. In 2022, Laurence became a co-author of her first scientific article, Bowel Stimulation Before Loop Ileostomy Closure to Reduce Postoperative Ileus, a multi-center, single-blinded, randomized controlled trial. Thank you, Laurence, for joining us, and I'll pass the session on to Laurence.
Hi, everyone, and welcome to this webinar on tips and tricks to successfully manage your ostomy. Thank you so much for taking time out of your busy schedule, and hopefully this presentation is going to be interesting and useful for you. So the learning objectives are going to be to define terms that are commonly used when discussing ostomy knowledge, to describe strategies for changing your ostomy appliance properly to avoid leaks, to gain knowledge about potential issues that can occur when living with an ostomy and learn how to manage them. And finally, to become empowered and feel more confident when living with an ostomy. So as a disclosure, I did receive financial support from Hollister to provide the content in this presentation. So the first term that I want you to know is what is the type of nurse that can help you with your ostomy. So we're called NSWOCs, which is short for Nurse Specialized in Wound Ostomy and Continence. Previously, we were known as enteral stoma therapy nurses, or ET nurses. And for those of you living in Quebec, the French name is stomothérapeute, so you might hear that one as well. And I just put a little picture of myself and two of my colleagues down there in the right-hand corner. That was taken during NSWOC week last year, and it just so happens that this week is actually NSWOC week. So if you do have an NSWOC, you can wish her happy NSWOC week. So next we're going to look at the different type of ostomies, because not everyone here has the same type of ostomy. The first one is going to be a colostomy, which is actually a fecal stoma, and it's located on the large intestine. And because it's on the large intestine, it means that the stool is generally soft or fully formed. And when you're looking at your abdomen, you'll find it on the left-hand side, but it could be anywhere, and it really depends how far it is or where it is exactly on the colon that will decide where it is located. Next is ileostomies, and these are also fecal stomas, but they're located on a part of the small intestine that's called the ileum. And for that reason, because they don't go through the colon, which absorbs liquid, the stool is going to be generally a thin or thick liquid, or it might be pasty stool. And usually you're going to find it on the right-hand side of the abdomen. And lastly, we have urostomies. They're also often referred to as ileal conduits, and these are urinary stomas. And the procedure is basically the surgeon will remove the bladder, and they're going to take the ureters, which are connected to the kidneys, and they're going to attach them to a small section of intestine. And then that small piece of intestine is going to be sutured closed on one end, and then it's going to be brought through the body out to the outside, and they're going to create an ostomy. And generally, this type of ostomy is also found on the right-hand side, like an ileostomy. So the next kind of terms that I want you to know is skin barriers. So skin barriers are actually the part of the ostomy appliance that you stick on your abdomen, and they can be categorized by their shape. And so you can have flat skin barriers, in which the surface that's in contact with your skin is, as it says, flat. They can be convex, and so when they're convex, the surface in contact with the skin has a curved shape, and that curve is going to be pushing towards your skin. And then the last type of skin barrier is going to be a concave skin barrier, and this is when the surface in contact with the skin has a hollowed out shape. Skin barriers can also be qualified or can be categorized by their types of openings. So you can have skin barriers that are cut to fit, which means that you're going to take a pair of scissors and you're going to cut the opening to the size that corresponds with your stoma. You can also have skin barriers that are pre-cut, and these types of skin barriers is when the manufacturer already cuts the opening to a certain size and you order a size of opening. And then finally, moldable is when the skin barrier can be stretched to fit to the size of your stoma. Next, we're going to look at different types of pouches. So some people might have closed pouches or closed or disposable pouches, and other people might have drainable pouches. Pouches that are closed are, as they say, closed on one end. And generally speaking, they either need to be discarded when they're full, or they could be reused if ever you're using a little liner inside. My clientele tends to use more drainable pouches. So these are pouches that are that have an open end at the bottom, so they need to be emptied. And you can have various types of openings based on personal preference or what type of stoma you have. But generally speaking, we have clamp closures, Velcro closures, or closures with a tap. And then when it comes to ostomy appliances, they can also be one piece or they can be two piece. So essentially a one piece appliance is when the skin barrier and the pouch are fixed together. So you're purchasing sort of one item, if you will. A two-piece appliance is where the skin barrier and the pouch come separate, and they're going to be attached together either with a mechanical coupling system. So a lot of the companies kind of have two rings that will clip together, or you can have an adhesive coupling where the pouch actually has a sticker on it and it will stick onto the skin barrier. All right, so tips and tricks for changing your ostomy appliance to avoid leaks. So when should you change your ostomy appliance? Honestly, frequency of change is really based on personal choice. So it can be based on how long your appliance actually holds for. It can be based on your provincial reimbursements, or it can be based on your budget. So it really depends. Most people are changing it 1 to 2 times a week, but obviously it can be more often For example, somebody who is wearing a one-piece closed pouch, if their pouch fills up once a day with stool, they're going to be changing it every single day. So we really do have a wide range. In terms of when you should be changing it, you want to have a schedule. You don't want to be waiting for a surprise to happen. You want to be avoiding leaks. So having a scheduled change when you know, if you know that, let's say your appliance only holds 7 days, you might plan to change it every 6 days to make sure that you avoid leaks. Obviously, it goes without saying, if there's a leak, it needs to be changed as soon as possible. And if ever you have an ileostomy or a urostomy, I suggest that you change your appliance in the morning. The reason why is as soon as you start to eat or drink, you'll notice your stoma will be a bit more active. And so you want to be trying to change your appliance when it's least active. So in the morning prior to eating and drinking usually is the best time when it's nice and quiet. Okay, so next question, how can I how large should I cut the opening to make sure that I can avoid leaks? So usually what you want to do is gently stretch the skin above your stoma so that it's nice and taut, and that's how you're going to measure your stoma. And when you're measuring it, you're going to use a size. You basically want to be cutting your barrier or ordering a pre-cut barrier where the opening is going to be snug around the stoma, and you just want it to be right next to the stoma, but not necessarily on top. Some NSWOCs will suggest 1 to 2 centimeters, but
correction, please note that the area in question is 1 to 2 millimeters rather than 1 to 2 centimeters.
But generally speaking, a lot of the literature is saying right up against the stoma. If ever the opening is cut too big or too small, then the seal might not be appropriate, and you might have issues with irritation to the peristomal skin, so the skin around your stoma, or you could even irritate your stoma. If it's too small, it could rub against it and hurt your stoma. So I talked about measuring your stoma, but do you really need to do it every time you change your appliance? So for the first 4 to 6 weeks, after surgery, the size of your stoma is going to change a lot because the swelling after your surgery is going to come down. So you want to be checking the size of your stoma at every appliance change. After 6 weeks, you could just verify it periodically because generally it will stay pretty stable. However, with time, there are certain things that can cause your stoma to change size, and things like weight gain, weight loss. If ever you get a peristomal hernia or a prolapse, these can cause your stoma to change size. So you might have to readjust the size of your opening. A good question that I often get is, in what position should you change your ostomy appliance? And to avoid leaks, I would say that you need to do it in certain positions. Your stoma changes when you're standing, when you're sitting, based on how much pressure there is in your abdomen. So generally speaking, when you're standing or sitting, your stoma is at its largest. So it's preferred to measure it and change your appliance when you're in a standing or sitting position. Avoid lying down because that's when your stoma is at the smallest. And also skin folds and creases are more apparent when you're sitting and standing, and that can help you to troubleshoot leaks if ever they do occur. So this is just to give you an idea. These are pictures from a colleague NSWOC nurse, Amanda, and these are some pictures of this same person living with an ostomy, but they're in different positions. So you can see that lying, standing, and sitting, the stoma sticks out more in certain positions. The folds and creases are much more obvious. So you really need to be looking at your abdomen in all those different positions. So other tips and tricks to prevent leaks. You want to make sure that your skin is nice, clean, and dry before you put on a new appliance. If there's still stool left over on the skin, or if there's old paste or residue on the skin, the next appliance is not going to stick well. So make sure that you get a really good clean surface. A lot of people suggest that you can apply gentle pressure or warmth. You really want to make sure that the skin barrier is stuck properly onto your skin. And sometimes, gently rubbing or adding a little bit of warmth can help with that. You want to make sure that you empty your pouch in a timely manner. So you can imagine if you always wait till your pouch be completely full before you empty it, that heavy pouch is always going to be pulling on the skin barrier and can, almost make it come off prematurely. So you don't want it always to be pulling on the skin barrier and be pulling on the adhesives and making them less efficient. So make sure that you're emptying your pouch frequently. Generally speaking, I suggest to my patients to empty it when it's a third to a half full. For those of you who have fecal stomas, so ileostomies and colostomies, you want to make sure that your stool is not too liquid. There's actually a lot of literature that shows that stool that's more liquid is more corrosive and it breaks down your skin barrier faster and makes you more prone to leaks. So there's certain things, certain foods that you can eat or certain foods that you can avoid, and even medications that you can take to make your stool a bit more formed. So these are things that you can speak to your NSWOC or a nutritionist or a pharmacist about. If ever you have a urostomy and going to the washroom to empty your urostomy pouch often is difficult, you could consider using a urinary night bag. And so this is a bag that you will connect to your pouch that's on your abdomen, and you hook it onto the side of your bed, and then that can collect larger quantities of urine. You may have seen them when you had, if ever after your surgery, you had a larger bag. That's sort of what I'm talking about. In terms of if ever you're having leaks at night, if ever you're having leaks sort of at night, you want to avoid having snacks after dinner, because then your ostomy is going to be active during the nighttime. So once you've had your meal, after that, try and avoid eating any, any snacks, any drinks and stuff like that, because your stoma will be more active and it might be active while you're sleeping, which means that you could have an accident. And if ever you're someone who really just has a lot of output during the night, unfortunately, sometimes it's best to just set an alarm so that you can check your bag instead of having an issue and having the pouch have a leak, and then you have to, manage that leak. So sometimes it's better to just set an alarm and get up. All right, so if ever you are having leaks, how do you troubleshoot them so that you can avoid them coming back or having this issue be recurrent? So first things first, speak to your NSWOC or your ET nurse. A lot of the time I have patients that call me and say, I've been having leaks for a month now, and I tried to fix it and it's not happening and I don't know what to do. And they come in and we take care of the issue like that. So if you do have an NSWOC or an ET nurse and you're having leaks, reach out to them. That's what we're there for. We're there to help you guys manage your ostomies, and we're more than happy to help you with that. If ever you want to be independent or you don't have an NSWOC, here's some other things that you can do to troubleshoot. First thing is look at the back of your barrier. A lot of people, when they take off their skin barrier, they just throw it in the garbage. But usually what I do is I like to look at the back of it and I can see where is the leak coming from, because I know that that's the issue, the area that has the issue. So when you take off your appliance, look and try and notice and see where the leak is coming from, because that's going to help you to address where the issue is. If ever you're cutting the opening yourself, you want to be checking the size, checking the shape, making sure that you're cutting it to the right size, because that could be a reason why you're having leaks. Is your stool too liquid? So I had mentioned it a little bit before that if your stool is very liquid, you might have issues with the appliance not holding or leaking. So if that's the case, you want to be maybe speaking to a pharmacist, speaking to your NSWOC, speaking to your doctor, or even a nutritionist, because there's certain foods and medications that you can implement into your diet, or medications that you can take. Also, if you want to look at some of the companies, ostomy companies' websites, they have a lot of great tools and resources about nutrition that you can take a look at. Also, take a look at what your stoma looks like. Is it sticking out? Is it flush to the skin? Is it retracted? If ever you have a stoma that's flush to the skin or retracted or not sticking out a lot, this can be a cause for leaks. If that's the case, you might want to consider trying a convex skin barrier. Some people use a stoma belt, which is a belt that you can attach onto the pouch, and it keeps the pouch kind of stuck and taut on your skin. So that's something that you can consider if ever your stoma is not sticking out. Like we said before, you want to be looking if there's any skin folds near your stoma. So if you look at your stoma or your abdomen when you're standing or when you're sitting, and you notice that there's skin folds, we often see them at like 3 o'clock and 9 o'clock on the sides of the stoma. If you do see that, you could consider trying a one-piece appliance, because they're usually like very flexible. You could also consider a soft convexity. So certain companies have a convex appliance, but it's much softer. And so it will kind of be able to fit into those folds. And sometimes people will also put paste or rings. And so you can put it into where the skin folds are, and it will kind of fill in that empty space and be like a little bit of a blockage so that the stool can't make its way out. And if ever, those things don't work or those things don't apply to you, sometimes I suggest to my patients to keep a journal. When are the leaks happening? Is it always at the same time of day? Is there a pattern that you can see? Because maybe there's something that's happening and you don't realize it. Is it, you ate something that gave you loose stools, and so maybe that's a food that you need to avoid? Is it possible that the leaks are always at night and you're woken up by them? So maybe you need to set an alarm. So keeping a journal can be something that's really, really helpful. So most common issues that we see with stomas, the first is irritant contact dermatitis. And that's basically a fancy word or a fancy term to say that you're getting skin irritation caused by leakage or by a large opening in the skin barrier. Essentially, the stool is touching your skin and it's irritating it, and it can make it red and raw, and it can be pretty painful. So first things first is you want to address the cause. If it's because your opening is too small or too big, you want to be readjusting the size of the opening. If you're having leaks, well, you need to find out why you're having leaks. A lot of people think a little bit of redness of the skin is normal, but it's not. You should have healthy, normal skin underneath your stoma, underneath your skin barrier, sorry. So if ever the skin is red and intact, you want to just be double checking the size of your skin barrier, and you can put it on. If ever your skin is broken down, weepy, and wet, you might want to put on some stoma powder or maybe a skin barrier wipe, and then make sure that you're sizing the appliance, the skin barrier, to the right size. Another common issue is skin stripping, and this is usually occurs when you remove the skin barrier too forcefully or too quickly, and so the top layer of skin stays on the adhesive of the skin barrier and pulls it off. So what can you do to prevent that? One, you want to be gentle and support the skin when you remove the barrier. So if you look at the picture in the bottom there, you can see that the person is holding their skin as they slowly remove the skin barrier. And so that's going to help support and avoid skin stripping. Also, you might want to consider using adhesive remover wipes. And so those wipes are going to break down the adhesives, and they're going to allow you to remove the skin barrier more gently. So those are two tricks to try and avoid that issue. Next is an itchy sensation when the skin is intact. So a lot of people think that itching is something that's normal, and it's really, really underreported. And peristomal itch is a common issue, but it's not visible. So unless you mention it to your NSWOC, we can't physically see it. And so it's something often that we don't necessarily address. So bring it up to them. Generally, it's caused by dry skin, and sometimes it can be caused by sensitivity to certain products. One of the things that you can try is a ceramide infused skin barrier. And so what these do is they provide natural moisture. They provide a natural moisture barrier, and they prevent water loss that can lead to skin damage and dryness, which is causing that itchiness. You could also try hydrating creams that are specifically made to go on the peristomal skin. So you can't just take any lotion and apply it on the skin, because they're kind of like oily, and it's going to keep your skin barrier from sticking properly. However, some of the ostomy companies do have creams that are specifically made to go underneath the appliance so that you don't have any residue, and that's not going to it's not going to impede the adhesion of your skin barrier. The next common issue that we see is peristomal hernias, and the prevalence is actually pretty high. And essentially what that is it means that a part of the intestine is sticking out of the abdominal muscle. It's still under the skin. It's not like sticking out. You don't physically see it other than the fact that it gives you like a bulge. So if you look at the picture on the right-hand side there. And a peristomal hernia is not an emergency unless there's significant pain, or maybe if you're not having any stool for a couple of days or something like that. But it can cause some discomfort. And so it is worth talking to your doctor, your NSWOC or ET nurse if ever it does happen, or if you're ever having issues, you want to speak to them about it. Generally speaking, a peristomal hernia is caused by increased abdominal pressure. So we'll see it when people are coughing a lot, if ever people suffer from obesity, or if ever you're doing repeated heavy lifting, and also with constipation. These are some of the causes. In terms of prevention and treatment, a lot of the companies on their websites have resources for you that are exercises to strengthen your core muscles. So that can help to prevent. And also you can wear stoma garments and stoma belts. So the picture on the bottom there is someone wearing a stoma belt, and that can sort of help to support your abdomen, and that can be used both as prevention or as treatment. So if that's the case and you have a hernia, you might want to speak to your doctor and know if that's appropriate for you. So next, we want to just talk about living more confidently with your stoma in general. So accidents, unfortunately, it is something that can happen. And so what's important is that you make sure that whenever you leave the house, you have extra supplies with you. You don't want to be caught leaving the house and you have an accident and you can't change your ostomy appliance. So make sure that you always bring stuff with you. You might want to consider also using barrier extenders. So if you look at the picture there, it's kind of like those half moon stickers, if you will. And what those can do is they can go over the edge of the ostomy appliance, and they're not necessarily going to stop a leak, especially if the leak is coming from the center, which a lot of the time it does. But what they can do is they can hold the edge down, so prevent the edges of the skin barrier from rolling. And if ever that's the cause of your leak, they'll keep the edge from rolling. And also a lot of people, just generally gives them a sense of security, because you can see the leak and you have a bit of extra time to address it and change your ostomy appliance before the leak actually kind of goes outside of the skin barrier. Gas and odor tends to be something that a lot of people are concerned about. So I think the first thing you should consider is watch what you eat. And you can look at the various companies' websites. They have a long list of foods that you can avoid, and it's nothing that's going to surprise you. You know, cabbage, beans, broccoli, cauliflower, eggs, all these things can cause gas or odors. So they potentially are things that you might want to avoid. Anything that's carbonated or fizzy drinks, if you're drinking little gas bubbles, then they're necessarily going to have to come out, and that's out via the stoma and into the bag. So you will have more gas if you drink carbonated drinks. It doesn't mean you can't drink them. It just means you need to be conscious that, yes, they will cause more gas. If ever you're finding that odors are problematic or bothersome for you, you can use deodorizers in your pouch. And there's many types that exist, and different companies have different ones. There's lubricating deodorants. So if you look at the picture on the left-hand side, it's kind of like little gel that you can put in the pouch, and it kind of helps the stool to slip more easily out of the bag, and at the same time also acts as a deodorizer. There's also little drops that you can put in. That's the picture there, sort of the second one to the left. And then there's also little sachets with like carbon in them, and those you can throw in the pouch. And so basically every time you empty your pouch, you would put one of these things inside. And so it's going to help to deodorize, so that when you empty your pouch the next time, there won't be any odor, or at least there'll be less odor. You can also use odor eliminating sprays. So that would be the picture on the right-hand side. And so these are kind of, you know, they're not like a Febreze where it might give you sort of a scent of lavender or something like that in the air. These are really sprays that have no smell. They're really just there to eliminate the odor, so they really neutralize smell. If ever you're having issues with gas, you might want to consider using a pouch that has a filter. Filters usually have carbon, and so they'll let the gas out, but not the odor. And so they'll keep your pouch from ballooning. And then finally, you can consider speaking to your pharmacist, because there are certain medications that exist that can help with gas and odors. And so you can speak to them and they can make some recommendations for what's appropriate for you. All right. So a big question that I often get is related to bathing, showering, and swimming. And a lot of people think that their appliance can't go underwater. And the answer is yes. Okay. The appliances, all the company's appliances are made to go underwater. They should be safe to go underwater. So when we're talking about bathing and showering, generally speaking, a lot of people are going to do it with their appliance on. So for colostomies, ileostomies, and urostomies, generally speaking. And if ever you're worried about the edges of your ostomy appliance lifting, you could use barrier extenders, and that could help to keep them down and make sure that they don't roll when they get wet. Without your appliance, generally speaking, it's mostly for colostomies, just because ileostomies and urostomies are very unpredictable, and you can have stool or urine come out sort of at any moment in time. So most people don't like going in the shower and then potentially having stool leak once they're getting out of the shower and drying off. But for colostomies, typically speaking, a lot of people are a bit more regular when it comes to stool. And so for them, they can remove their appliance, shower, and then put the appliance back on afterwards. The only consideration, if ever you choose to shower without an appliance, is just to make sure that you rinse the skin really well, to make sure there's no soap residue left on your skin that can impact adhesion of the skin barrier. And then when it comes to swimming, obviously you want to make sure that you have an appliance that's intact prior to getting it wet. So you don't want to have an appliance that's already a bit iffy, that you're not sure how well, or it's due to be changed, and then go swimming in a pool. It would be a better idea to make sure that you have, you know, an appliance that's well on there. You might also want to consider using barrier extenders. And then, you know, a lot of people wonder, well, what do I do in terms of bathing suits? And honestly, it's really up to you and whatever makes you feel confident. If you don't mind showing your ostomy appliance, you can wear a bikini, you can wear a tankini. If ever you're feeling uncomfortable and you don't necessarily want people to see, then maybe you're going to wear a one-piece bathing suit, or maybe, you know, a rash guard, which is like those SPF t-shirts that are meant to get wet. So it's really whatever makes you feel confident. And if you do look on social media, there's tons of influencers that are out there that wear bikinis and show off their ostomy appliance. And maybe for you, you're not ready for that, and that's fine. But just know that there are people that do it. And if you feel confident, then it's totally fine. And you can wear a bathing suit that shows off your ostomy appliance. So the last thing that I want to talk about is travel, because I know it's a significant concern for a lot of people who are living with an ostomy. And so what you need to know is that, yes, you can travel, but there are certain things that you need to take into consideration. First things first, no matter where you're traveling to, whether it be a weekend getaway or, you know, a week abroad in Europe, you want to make sure that you're packing extra supplies, because you don't want to be caught not having enough stuff if ever you were to have an accident and or a leak or whatever may happen. You want to make sure that you have supplies so that you can change your appliance no matter what. If ever you're traveling by air, you want to consider putting supplies in your carry-on and your checked luggage. So just in case something gets lost, you want to make sure that you have enough supplies available to you. You might also want to consider researching where you can get supplies at your destination. So if you're going, for example, to Florida, you know, you're what we call a snowbird, and you like to go to Florida every winter, well, maybe it's worth it to look into where you can get supplies while you're there. In terms of travel, you also might want to think about pre-cutting your barriers. So if you're someone who has a cut to fit barrier and you're cutting it yourself, you might want to measure your stoma and then cut a couple barriers to the right size so that if ever you're traveling, for example, I don't know, by car and you have an issue and you need to change it in a public bathroom, or if ever you're in an airport, it might make the change a little bit easier. So that's something you can think about if ever you're not as comfortable cutting your barriers. If ever you are comfortable cutting your barriers and you're doing air travel, I actually looked into what the CATSA says. And so you're allowed personal items such as disposable razors. So that includes like blades, blah, 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 blah. But what we're talking about more specifically here is in terms of you're allowed small scissors with the blade up to 6 centimeters or less. So if you look at the picture that I put there on the right-hand side, when you look at the scissor, the size of the blade, so from sort of where the screw is to the end of the blade, has to be maximum 6 centimeters. If it's less than 6 centimeters, then you're allowed to bring it in on your carry-on and you could use it to cut your barrier, let's say if you're at the airport. Other tips that I can think of, especially during air travel, is to choose a seat that's near the bathroom. And I know usually these are not the most popular seats, but when it comes to air travel, and if you have an ostomy, you want to be close to the bathroom, because when that, for example, if there's turbulence and the seatbelt sign comes off, a lot of people are going to rush to go to the bathroom, and then that allows you to be the first one there, and you don't have to wait in line if ever you realize that your pouch is really full and you want to be emptying it. Also, another reason to be close to the bathroom is that if ever the drink and food cart is in your way and you have to sit there and wait for the drink cart to get past you, that can be very frustrating if you feel like you need to use the washroom to empty your pouch. So just something to consider, even though they're not generally the most popular seats. In your case, when living with an ostomy, it might be something that's helpful. When you're traveling by air, you might want to consider using a pouch that has a filter, even if you don't usually have one. And the reason why is that air expands at higher altitudes. So if you've ever looked at your bag of chips that you bring with you in the plane, the bag kind of puffs up in the air. And the same thing is going to happen with any air that's inside your ostomy appliance. So for that reason, a filter could be useful if ever it's something that you're interested in trying out. I would also suggest that you take a look at Ostomy Canada. They have an ostomy sort of passport or document that you can use for security checks. A lot of the companies have it. I know the Quebec chapter, sort of the Quebec Association of People Living with an Ostomy, the ISPQ. They have a passport that they've made. So it's basically, it explains sort of what an ostomy is and why you need supplies. So that can also be useful for checkpoints and security checks. And then the last thing that I want you to know about travel is that if ever you're going to a hot destination, just make sure that you're drinking plenty of fluids, because you're more at risk of getting dehydrated, especially people with a urostomy and with an ileostomy. If ever you're losing a lot of water, you might end up getting dehydrated pretty fast, and you won't feel great, and it might ruin your travel. So you want to avoid that. So thank you really much. Thank you very much. Sorry. That's it for the information that I have to share with you. And now we're going to go to the question period.
Amazing. Well, thank you so much to Laurence here. And we're going to invite Tarek, and we're going to invite Laurence to come on here to answer some questions. And I apologize if anyone was getting an echo earlier when I started there. I hope it's resolved now, but if not, I'll do my best to fix that. But I do want to invite Tarek and Laurence on to maybe just go over some questions. Thanks again for that great education, Laurence.
Thank you for having me.
Yeah, thanks so much, Troy, and thank you to everyone who has submitted questions and who are submitting questions. Prior to the question period, I'd just like to highlight that the information in this presentation and in the question and answer period are provided expressly for information purposes only. In no way are there any of the materials that have been presented here meant to be a substitute for professional medical care or attention by a qualified medical practitioner, nor should they be construed as such. Always check with your doctor or nurse if you have any questions or concerns about your health condition or before starting a new program or treatment. So I'll start off the questions. And first question is, why do I experience leaks when I apply my appliance consistently over time?
Yeah, so that's actually a pretty good question. I think we touched on it during the webinar. And so you can have leaks for many different reasons, even though you're applying your appliance properly. So you want to make sure that you're changing your appliance probably in a standing or seated position so that you're stretching out the skin, making sure you stretch out those skin folds. You can see the skin properly so that you can make sure that if ever there's folds, you might be using an appliance that's appropriate for it. Making sure that you're measuring the stoma as well. If you might be doing a great job putting on the appliance, but if the hole is not to the right size, that could also have an impact. And I also touched on it quickly, but if you do have an ileostomy or a colostomy and the stool consistency is too liquid, you could have issues as well.
Yeah, thanks so much, Laurence. And again, it's a great reminder when changing the ostomy appliance, it's best in a sitting or standing position and not lying down.
Yeah, and it's something that not a lot of people know. So,
well, it's a great tip. When I teach at Dawson College in the Department of Nursing, one thing during the ostomy lecture, I tell the students to do is, if you go home and you're lying down, put a piece of surgical tape from the top to the bottom of your abdomen when you're lying down. Press the tape on and then sit up. What happens? Well, creases and folds form sometimes almost immediately. And the same thing may happen with your ostomy barrier for many people if it's applied in a lying position. So thanks so much.
Absolutely. Yeah.
Here's another question. What are best practices or your recommendations for using barrier type rings or paste when there's uneven surfaces on the skin?
Mm-hmm. So, I mean, barrier rings and paste can be used to fill in creases or areas where, the skin is not necessarily flat. For myself, and what I tell the people that I'm working with is that I generally like to, if I'm filling in, let's say a crease, I'm going to put it sometimes directly into the crease. However, if I'm not necessarily filling in a crease, I'm going to put it directly on the barrier because I know if I've cut it to the right size, it's going to be going at the right place. So, I mean, both are correct and you can try what works best for you. But if I'm really trying to fill in a crease specifically, sometimes I ask my patients to bend forward, see where the crease is, and then put the whatever they're using, whether it be a ring or paste, into that crease so that we know it's getting to the specific spot.
And that's a great recommendation. I love the way you used, the term just bending forward and looking at the abdomen, because creases and folds sometimes form, upon certain movements. So that's a great tip. Thanks, Laurence. Another question is this one, and this may apply for people with a colostomy. How can I reduce what's called pancaking and leakage under the ostomy barrier and ring when I'm wearing clothing?
Yeah, so I think I saw in the Q&A, some people were asking about it, and in the questions we got beforehand, we got a few people asking about pancaking. So essentially, pancaking occurs when the pouch, how can I explain this? When the pouch lies flat onto the stoma. And so essentially the stool can't fall into the bag and it stays and it accumulates near where the stoma is, and then it ends up seeping and going underneath the skin barrier. And so there's a few things that you can try. Sometimes what happens is if you have a pouch that has a filter, the filter can, as it's letting the air out, kind of act as a vacuum, and it kind of squishes onto the appliance, onto sort of your stoma. So if ever you have a pouch with a filter, you could try putting the little stickers. I don't know if you've noticed that some of the companies, when they in the box that has the bags, they have these little stickers, and you can place those over top of the filter, and that can help with sort of that vacuum effect. There's also some companies that have pouches with and without a filter. So you could try potentially using the appliance that, or sorry, the pouch that doesn't have a filter and see if that makes a difference for you. I talked about the lubricating deodorants. So using the lubricant effect, if you can put that at the top of the pouch, and it can try and help the stool slide down into the bag. And last thing is, if ever you have a one piece, you might want to like blow into the bag to kind of leave a bit of air space before putting it on. Or if ever it's a two piece, just make sure that you've kind of pulled it out a little bit, because having a little bit of air in the pouch will prevent it from sticking onto your stoma and having that pancaking effect.
Thanks so much, Laurence. Those are some great tips for pancaking. Another question is, when a person has an ostomy that's pretty much flat, in other words, it's not sticking out, or even at skin level, or even below skin level, when they're problematic and there's leakage, what do you recommend?
Yeah, so generally speaking, we do tend to see that when people have a stoma that is flat to skin or retracted, that we will have more leaks because the stool has more difficulty falling into the pouch. So some things that we can try is using a convex skin barrier. If the stoma is very like flat, it can help to push it outwards so that the stoma is sticking out a little bit more, and then the stool falls more easily into the bag. Sometimes I also like to use a stoma belt because it does kind of keep the appliance nice and taut on the skin, and it does help to push the stoma out a little bit more.
Thank you. Laurence, there was a question in the chat. And the question is, what is a barrier extender? Would you like to tell us a little bit about a barrier extender?
Yeah, I had a little picture in the presentation, so you can always go back and look. But barrier extenders are most companies, they're a piece of hydrocolloid, which is sometimes we use it actually as dressings, and so it's a little, often they're in a moon shape. There are some companies that have various shapes, but it's essentially kind of like a little sticker that you can go and stick on the edges of your skin barrier, and it kind of extends it a little bit more. They're very soft on the skin, so they can kind of be removed a little bit more easily sometimes than the various skin barriers that you have. And they're not necessarily going, like I said, they don't necessarily stop a leak, but they really go over the edge of the tape, and so it helps it from rolling up and then causing a leak for that reason.
Yeah, thank you, Laurence. And it just highlights the importance of knowing, a little bit about accessories products.
Mm-hmm.
Always needed, but sometimes they can make a difference for people when they're used for different purposes.
Yeah. I mean, I tend to be a less is more NSWOC. I like to start with the basics, and then based on what the person is experiencing and their personal issues, then I'll add on those accessories. But I don't usually start people with a lot because it can be confusing, and sometimes it's not necessary and it's just extra cost. So it really depends on what what's happening with your stoma.
Absolutely, and cost is so important nowadays. So thank you for that tip, Laurence. In terms of, we had a couple of questions on peristomal skin health, and one of the questions was how much redness or irritation around the stoma is normal for a person who's had an ostomy for a long time?
Yeah, so I think the correct answer to that would be that no redness technically is normal. Okay, when you have a stoma, I mean, when I do teaching for my with people prior to having surgery, I often tell them the skin should be like the skin anywhere else on your body. If ever you do have redness, that's a sign that there's something going on. There's some form of complication happening. And is it potentially because there's irritation from the stool? Do you maybe have an allergy to the product? Are you cutting the barrier too big? But generally speaking, redness is something that people experience, but a lot of people think it's normal, and so they don't speak to their NSWOC about it. So what I would suggest is if you have any type of skin discoloration, you should probably speak to your NSWOC about it so that she can take a look, or he or she can take a look and let you know why they think that redness is there, because technically no redness is normal.
Yeah, and that's so important, Laurence, because redness is really a first sign of skin irritation, and as it progresses, it'll usually worsen and be much harder to manage. And along that line, we had a question of, do you have any suggestions for skin irritation when it's due to leakage, but also when the appliance is adhesive, overly adhesive, where some people feel that it's difficult to remove?
Yeah. So some people have difficulty removing their appliance, whether it be because your skin is just perfect for that tackiness of the skin barrier, or sometimes people might have, more hair on their abdomen. So if ever you are having difficulty removing the skin barrier, you might want to consider using those those adhesive remover wipes, because they can break down the adhesive a little bit and help to remove it without trauma. And now I forget the first part of your question, because I answered the second part.
I guess like skin irritation, but you did answer that partially in the prior question. So
Yeah,
I think a great response, and the other one to skin irritation. Well, it's interesting along the lines of skin health. We had a question about some healthcare professionals or some manufacturers of ostomy equipment state that nothing should be applied to the skin prior to putting on your ostomy barrier. For example, the skin protective wipes. What are your recommendations, Laurence, on that topic?
Yeah, that's a good question. And coming back to the idea that I'm a less is more type of NSWOC, I would say preferably, and from speaking to the various reps from the different companies, most companies do recommend trying to put the barrier directly on the skin. And if I can explain it kind of in a simple way, our skin is not perfect, okay? So it's not completely straight. It has, like little bumps and stuff like that. And the adhesives are able to stick to our skin because there's sort of those little bumps and cracks, like miniature, like microscopic. And when you put a skin barrier wipe, it actually kind of makes the whole surface flat, and it doesn't have as much, the barriers often have more difficulty adhering. So I would suggest that having nothing on your skin would be the best. Obviously, if you have some skin irritation and you're treating it and you're going to be putting some powder or a wipe, then that's fine. You can put it localized where you're having the issue. But generally speaking, it's not necessarily recommended to be wiping a skin barrier wipe all over your skin every time you're changing the appliance, because that could also be impacting how well the skin barrier is able to stick to your skin. And that would even go back to the first question of, I'm consistently doing a good job changing my barrier, how come I'm having leaks? It could be something as simple as that, putting the barrier wipe is not letting the adhesives work as good as they actually should. Oh, Tarek, you're on mute. I can't hear you.
Yeah, thanks, Laurence. One of the questions we had was on lifestyle type areas, and for people who are active, for example, in sports, contact sports, what can be done to protect the stoma from injury?
So there are, as far as I know, there's one company. I don't know if there's any others that I'm not aware of, but there is something that's called a stoma guard. And it's kind of like a plastic plate, if you will, that you can wear on top of the stoma. And so if ever you're doing, let's say, contact sports, or if ever you were to do, something where, you're going hiking, you have a bag that you might be tying around your waist where there might be a potential of rubbing, then this is something that you can put on top of your stoma to protect it from possible, trauma or irritation that might occur when you're doing something that's a bit more active. Or even maybe if you're in a job that potentially has, a risk that, maybe, I don't know, for example, someone who's a daycare worker and there's kids that are often, grabbing at your abdomen or something like that, and you want protection, that's something that you could use as well.
Yeah, thank you, Laurence. And as we wind down, I think we have time for perhaps one or two more questions. One of the questions that we had previously, and also that's in the chat, is how can pertain to people with an ileostomy and specifically to a blockage. So how can blockages with my ileostomy, which can be very painful, be relieved, or how can one address these?
So typically speaking, we do consider a blockage to be like a medical emergency. So the best thing would be prevention and not getting to that point. There are certain foods that you can avoid, that foods that tend to be like very fibrous and stuff like that, nuts. I always give an example of, like, you can imagine eating a piece of celery, and that long stringy piece of celery clumps up and makes a ball, and that's going to block the passage. So you can look at the various companies. They have great resources of foods that you should be potentially avoiding, especially if this is something that happens to you over and over again. Those are maybe foods that you want to completely cut out. In terms of prevention as well, making sure that you're drinking a lot of fluids and making sure that you're chewing your food really well. And then if ever you do have a blockage, so generally the signs will be like output will be decreased. You might be, have bloating, pain in your abdomen, potentially nausea, and that's usually caused by food blocking the passageway. If that is the case, you can speak to your NSWOC, but often patients end up having to go into the emergency room because it is something that needs to be looked at, more closely.
Absolutely, and that's a great point. If persistent pain is present, it's really important to go see your healthcare professional at the emergency room, and not just simply make a call to an office that won't be open until a day or two.
Exactly. Yeah.
There's a question in the chat, just out of curiosity, and the question is, do manufacturers make pre-cut ostomy barriers? And
I mean, you could answer that one, Tarek.
There's many different pre-cut sizes. The question too was, from all manufacturers. So definitely feel free to contact the manufacturer in question, or the manufacturer of the product that you are using. But in terms of which size should you use? So if you're, let's say, Laurence, my stoma is 25 millimeters round, or 1 inch round. What opening size should I look at?
I'm actually happy that you asked this question, because as I listened to myself talk, I realized that I said 1 to 2 centimeters larger, and actually I meant maximum 1 to 2 millimeters. So thank you for asking this question, so I can correct what I said originally. If you're getting a pre-cut barrier, you want to be getting it to, obviously you want to be measuring when you're in a standing or seated position, because that's when your stoma is going to be at the largest, and you want it to accommodate your stoma when it's at the largest size. In terms of choosing the correct size, you want to choose the size of your stoma, or potentially a little bit bigger. You don't want to go smaller, because then it could potentially irritate your stoma and cause other issues. So a little, like, sometimes you're 25 millimeters and the company only has 26. You could go a little bit larger.
Excellent. Thank you, Laurence. And I'll, at this point, it's 6 p.m. Eastern time, and I'll pass it to Troy to take over from this point. Thank you so much, Laurence.
Thanks, Tarek.
And yeah, thank you to both of you. I'm so happy we were able to get through so many questions there. I know we're always going to have some more questions, but I want to assure everybody who's attending today, and your colleagues, friends, family who might be still having some of those questions, one of those recommendations is, of course, to get in touch with your NSWOC if you can. We have a Find an NSWOC tool on our Ostomy Canada website you can use if you maybe you moved recently, or maybe you haven't got in touch with an NSWOC recently. We do have a tool on there. We also have a myriad of blog posts and written news posts from our Medical Lifestyle Advisory Committee on our Ostomy Canada website. So some of those frequently asked questions that maybe we didn't get to today, but you might think other people have been running into, we have some of that there. And again, I'm going to encourage you to take a look at our past webinars as well on some great topics. But thank you to Laurence and Tarek for taking us through such great education today. And again, really, really thanks to Hollister for being able to make this possible. We truly appreciate your support. And I know the people who are attending here would echo that too. For those who are going to be, or I guess those who are in attendance today, you're going to be getting a post-webinar feedback survey that we would like you to put in there. We've heard some great suggestions about maybe looking at different times for webinars in the future, seeing how we can accommodate people from across Canada. So we always appreciate your feedback. So definitely take a look at that when it comes into your inbox after the fact. But I'll kind of stop talking there, and I'll just say thank you one more time to both of you too. Thank you to everyone for tuning in today. We really appreciate it, and we look forward to seeing you on our next webinar on July 17th. So we'll talk to you again in the summer. Have a great rest of the day, everybody, and take it easy.